Hi, this is Dr. Paul, and I'm sitting with Dr. Dr. Jafarieh, chiropractor in Fort Lauderdale, Florida, right here. And the topic we're covering today is what is a whiplash injury and how can a whiplash injury be treated? So let's go into the first question, Dr. J, if you don't mind, what is a whiplash injury exactly?
Well, whiplash injury, as most people are familiar with, is an injury that happens while involved in an auto accident, mostly when patients are rear-ended.
Right.
When drivers.
It's kind of a general term.
Exactly.
Okay. But specifically, what happens to cause an injury?
Actually, several things happen in that very, very short period of time. Most people think that, okay, their neck is going to get snapped back and forward, and that's what the injury is. In reality, there has been several studies done where they really studied at different times of this whole incident, what the body goes through, and it's actually multiple injuries, one into another, one following another, where the initial injury happens, and then there is the brain, the spinal cord that really slams against the spinal canal and the skull, and then the last part of the injury that happens where there is a more axial and shear tearing of the ligaments and tendons.
Let's go into that a little more. Now, you covered a lot of material right there. Let's help me understand this. So you said there's several injuries in one.
Yes.
Okay, let's break this down. The first injury is what?
Where the patient goes into the whipping motion, where they are slammed back and then forward.
Okay, so the first impact, so to speak.
Yes, the first impact.
Okay, now, so that's the first injury.
Yes.
Now, what's the next injury?
So now the brain gets thrown inside the skull, and the spinal cord is being also thrown against the spinal canal.
See, that's not what as a layperson patient, if I were thinking of a whiplash injury, I wouldn't even consider that. I would think of it all as one.
No, actually,
I wouldn't think of it as separately, that the brain's moving separately from the skull.
Yes, actually, this is a crucial part of a whiplash injury, and it gets overlooked, as you said, because we don't really pay attention to this part of it. But it's an important part, because we're talking about soft tissue of brain and spinal cord, and injuring your brain and spinal cord has very big ramifications, consequences.
Right. And it's very sensitive.
Very sensitive
very
tissue.
Sensitive tissue, yeah.
Yes.
Okay. So let me understand this. So the first injury is maybe your head actually hitting something, whether it's the dashboard or your head or your back of your seat. That's the first injury you're referring to.
Yes.
The second injury is more internal, it sounds like.
Absolutely, yes.
And help me out with that. So it's what? So you're saying it's the actual brain
and
following in the course of that motion.
Yes, following the direction that the body had at the time, before the time of the impact.
Okay.
But then the body stops, and
the momentum.
The momentum, but the brain and the spinal cord continues in that direction.
Okay, and so you're saying that now impacts the skull.
The skull, the brain inside the skull, and the spinal cord inside the spinal canal.
Okay, and so that's the second injury.
The second injury.
And you're saying the reason that's so important is because now you're talking about.
We're talking about
the
brain
nerves.
tissue, yes.
Yeah, we're talking about the nerves.
And nervous system, yes.
Okay, and then what's the third injury?
And the third injury is actually there is the shear movement of part of the entire spine, the entire segments of the spine, they all don't move in the same direction. So one part would stay and another part would move in a different direction, and at the level where the two parts of the spine are moving in different direction, that's where the tearing of the soft tissue, ligaments, tendons,
and you call that shearing?
Happen in that. So that's a part of the whiplash injury.
Okay.
That happens, and there is also a pressure coming from top to bottom, an axial pressure that happens in the spinal cord at the same time. So the pressure goes through the bones, through the disc, downward, creating pressure on the disc, creating bulge or herniation at the level of increased in pressure at the disc levels.
So there's a lot going on.
Yes.
So whiplash injury, there's a lot going on.
Yes.
Okay.
So that there is not only, it's not just the forward backward movement of the neck. There are different directions in different parts of the spine. Not only there is tearing of ligaments, soft tissue, ligaments, tendons, and muscle. There is pressure going through the discs, creating disc problems, and there is also injury to the brain and soft tissue of the brain and spinal cord.
But you know what? As you described it, it sounds like you don't even have to have tearing of the ligaments, tendons, or discs to still have a nerve injury to the brain or spinal cord.
Absolutely, because there were different phases, and in
Yeah.
each phase, different parts of the body are being injured.
Yeah, that makes sense. And so that makes a lot of sense. Is that why? What would you call some of the symptoms in it? Because it sounds like that could be a lot of different symptoms.
Yes, so we do have the injury to the ligaments, muscles, tendons. So these are mostly, we call them sprain strains of the ligaments,
Right.
tendons, and muscles, which are translated into muscle stiffness, pain, inflammation.
And that's more common. You would
More
expect
common.
that. What are
Yes.
some other symptoms?
But also the symptoms of where there is damage to the soft tissues of the brain and spinal cord, that's when you can experience ringing in the ears, headaches, dizziness, blurred vision. These are all symptoms that are associated
Can
with whiplash.
your memory be affected with that also?
Absolutely, yes.
Well, let me ask you this.
Confusion.
Let me ask you this. Is it possible not to have, the neck injury, like tearing of the ligaments and all that kind of stuff, being a whiplash injury, but suffer these other nerve symptoms like blurred vision, ringing in the ears, memory loss, but no real neck pain or stiffness? Is that possible with a whiplash injury?
It would be rare that you can have those symptoms but not have neck pain or stiffness, but it is possible.
Right.
It is possible because, as I said, there are three different injuries within one.
Right.
So the extent of injury at each phase is different. So you may have more injury to the second phase where there is your brain hitting the skull and there is damage to the soft tissue of the brain and spinal cord, and experience more of the neurological problems, but not have so much damage in other phases where there were tearing or stretching of the ligaments, tendons. So it is possible, but not to that extent.
So it sounds like there's a lot of different anatomy that can be involved here.
Absolutely.
So, what would you do? What would you do to help something like that, a whiplash injury? How could you help a whiplash injury?
First, a thorough examination is needed because we're dealing with a lot of very sensitive tissue, a sensitive part of the body. Okay, so a thorough examination and diagnostic imaging, if needed, are necessary so that we can determine the extent of the damage.
Because you're talking about a lot. We got bones, we got disc, we got nerves, central nervous system, spinal cord,
Absolutely.
muscles,
Yes.
ligaments, tendon. We got a lot of stuff to look at here.
That are involved and could be injured to different degrees, different
degrees,
extent.
okay, so-
So the examination, diagnostic imaging would determine.
That's a workup, isn't it?
Yes,
You-
and usually whiplash injury examinations and workups do take a good amount of time.
Because of that.
Yes, to
That makes
determine the extent of the injury and
Okay.
the exact areas of injury.
Now, how can you help that? Let's say I have a whiplash injury. Boy, that's just almost too big of a question, isn't it? Because so many different things can be affected.
Yes, and again, but the body would go through the phases of healing.
Right.
Okay, and we have to assist the body going through those phases of healing, making sure that the body is going to heal correctly.
Okay,
and-
I'm in a whiplash. I've got whiplash. What do you? I've come in. You've diagnosed it. What are you going to do to
Well,
help me?
hopefully you came in before the 72-hour
Okay.
period.
Let's say I did. Take me through how
All
you would
right.
help
So
me.
hopefully you came in before the 72 hours, for 72 hours. So you are in your inflammatory phase.
Right.
So first thing that we have to do, let's say that we did the necessary examination, diagnostic imaging, and we know what your problem
Right.
is, the extent of it. We need to take you through the inflammatory phase by making sure that we can decrease your inflammation as much as possible so that the inflammation, which is a normal response of the body in that healing process, does not get out of control and further cause damage to the area.
And how are you going to do that?
By decreasing the inflammation by using therapies that decrease inflammation, such as ice therapy, electrical stimulation, and other therapies that would soft tissue work that would decrease muscle spasm in that
Okay.
area.
So that's the first thing you're going to try to
Yes.
do.
Yes.
Okay. Take me to the next. What happens next? How are you going to help me after we decrease my inflammation?
Next, we know that the body is going to, after 72 hours, start the process of repairing.
Okay.
Remember, we talked about body going into different directions at different levels, so you can have tears or overstretching
Right.
of certain ligaments,
Right.
tendons, and muscles. So now, if there is any breakage or any overstretching, the body is going to try to repair that.
Right.
Okay, so we want to assist the body in that repair process making sure that the body doesn't heal wrong, it heals
Okay.
correctly. So we'll do therapies that would assist the body in during the repair process, and also we'll start introducing gentle spinal manipulation, making sure that now the body's start depositing scar tissue. And if this is not prevented, patients can end up having a lot of stiffness and pain and muscle spasm down the road because it was too much scar tissue built during the repair process.
Let me itemize. So let's itemize this out. So during the repair, you're going to do spinal chiropractic adjustments.
Yes.
What's the objective of that to help with whiplash? What are you trying to do there?
Increase mobility in the joints,
Okay.
relieving pressure on the nerves, and also make sure that there is enough movement so there is not scar tissue built around the
sense.
joints and around the nervous tissue where the nerves exit the openings around the spine.
And then another therapy you said you would use was electric stim?
Electrical
Okay,
stimulation
and what's the objective there?
to bring down muscle spasm and
Okay.
bring down inflammation.
So you're working with the
still.
muscles with that therapy?
Yes,
Okay, and what was
yes.
another therapy you said?
And trigger point therapy is also to bring down muscle spasm
you're-
because now the body's
again,
guarding,
Okay, gotcha. So
Okay.
you're working with the muscles again.
working with the muscles again.
And then what was another therapy?
And we also do neuromuscular stretching during that area where we activate certain nerves in the body with certain groups of muscles, which would allow other groups of muscles to relax and
Okay.
let go, so we can work on the joint mobility, make sure that the scar tissue doesn't build again in the
Okay,
joints,
okay.
and we can preserve range of motion in the joints.
Okay, and then,
following the injury.
so you're gonna use a combination of therapies for the
And spinal
disc, the
manipulation.
joints, the muscles, the ligaments,
nerves.
the nerves, okay.
Mhm.
So and you do all this in your office?
Yes,
Uh-huh.
absolutely. And then
Okay.
following that, we would move into the repair, into the remodeling phase, where we actually assist the body in becoming now strong, making sure that now that the repairs are done, a joint is as strong as the muscles surrounding it are. So we want to make sure that the muscles are strong, the tissue that was laid in there is of good quality.
And what happens if I
sustain.
don't get that strength back? If I don't go and get the repair phase and the strength, or the remodel and get the strength back, what'll happen?
You can actually end up having permanent injury, permanent damage from that trauma. Even to a minor degree, you would have minor headaches, minor neck pain, minor upper back pain,
Ongoing?
ongoing for the
Is that
rest
right?
of time.
Do you
Yes.
see patients like that have been on old auto injuries that now, to some degree, have some chronic ongoing problems?
Most patients who come in not related to an immediate auto accident have had some type of trauma in the past.
Okay.
A few years ago, they've had, if it was not an auto accident, at least it was some kind of a traumatic injury.
Is it safe to say they did or didn't get the proper therapy?
They did not get the proper
Oh,
therapy.
okay, okay. I got you. All right, well, that was very good, informative. Again, we're talking with Dr. J, chiropractor in Fort Lauderdale, Florida, and it's Dr. Jafarieh. And you can reach her. By the way, Dr. J, how can our viewers get in touch with you?
Well, we can be reached at by phone at 954-229-1995.
Okay.
We are also located on 1515 East Commercial Boulevard, which is East Fort Lauderdale between Dixie Highway and US 1 on the north side of the street.
Okay, good. All right, that was real informative. And if you've been in a accident and you suspect a whiplash injury, then obviously Dr. J here is the one that can help you out. So give her a call. You take care.